Bismillah ar-Rahman Rahim. So I'm going to describe rehabilitation perspective in Parkinson disease. And before I start that, I would like to sort of like describe that what are the factors that contribute to disability in Parkinson disease. So in no particular order, but there are many factors that can contribute to this. And first of all, reduced tremor is one of the earliest symptom of Parkinson disease. And because of tremor, the person is unable to contribute to daily living that before Parkinson disease. In addition, Parkinson is associated with bradykinesia, weakness. Sorry, I think I disconnect. Okay, just give me a second again.
Yes, sir.
So as I was describing that there are multiple factors that contribute to disability in Parkinson disease. One is reduced manual dexterity. Tremor is one of the first symptom of Parkinson in most of the cases. And because of this reduced manual dexterity, the patient is unable to use the hand as he or she could use before Parkinson disease. In addition, Parkinson is also associated with reduced mobility and bradykinesia. And the patient with Parkinson is at increased risk of falls, which can lead to increased mortality, morbidity, and a prolonged and the patient being confined to the bed for a prolonged period of time. Parkinson is also associated with a feeling of fatigue, difficulty in performing ADLs. ADLs are activities of daily living. These are the things that a human being would need for performing daily activities like bathing, movement, toileting, maybe cooking food, and moving from one point to another. But a patient with Parkinson disease, because of reduced manual dexterity, fatigue, reduced mobility, would not be able to perform ADLs as compared to a person who has no Parkinson disease. In addition, many patients with Parkinson disease would have speech impairment, which could be frank dysarthria or difficulty in understanding what the patient is going to say. Many patients with Parkinson also develop dysphagia, which reduces their nutritional intake and ultimately contributes to the overall fatigue of the patient. And as a result of this, we have a patient with Parkinson disease who might be having a good medical treatment, but is basically confined to the home, is not able to communicate, is not able to enjoy life, and has a very poor quality of life. The answer to this symptom is a multidisciplinary rehabilitation management. And the important team members of such a rehabilitation team must include a rehabilitation medicine physician or a physiatrist who works along with multiple rehabilitation professionals like a physical therapist, occupational therapist, speech therapist, a clinical psychologist. And the center of this treatment team is the patient and family who decide the course of that rehab treatment. I'm going to describe the role of each of the members in detail later on. Research in the last 40 years has shown that an early, coordinated, multidisciplinary rehabilitation is of many benefit to a patient with Parkinson's disease. Some of them include improved motor function. I just described that one of the major issues with patients with Parkinson's disease is motor dysfunction, maybe in form of fatigue, bradykinesia, reduced mobility, increased risk of fall. So rehabilitation addresses all these things, and by doing certain kind of physical therapy exercises, balancing coordination exercises, the patient can regain improved balance, the gait pattern improves, and the physical functioning of the patient also improves. A patient with Parkinson's disease is at increased risk of falls. By appropriate interventions like balancing exercises, biodex board, rocker board, wobble board, Frankel coordination exercises, certain stretching and strengthening exercises, the overall risk of falls is reduced in a patient with Parkinson's disease. The exercise and rehab plan also acts at the molecular level, and it actually delays the progression of Parkinson's disease. And all of these ultimately lead to an improved quality of life and improved mobility for the patient and improved community reintegration. There are certain considerations while offering rehabilitation in a patient with Parkinson disease. The first and the most important is earlier is better. So whenever you as a neurologist or maybe as a general physician make a diagnosis of Parkinson disease in a patient, it is important that you not only address the medical management by giving certain medication, you should also refer that patient for rehabilitation intervention at an earlier stage. Because please remember that rehabilitation interventions are the most effective in mild to moderate degree of Parkinson disease. Once severe Parkinson sets in, where the patient is totally bedbound, unfortunately, that patient might be needing a palliative care, but not active rehabilitation. So earlier is better. Parkinson disease not only helps with weakness and bradykinesia and fatigue, it also helps with non-motor symptoms, maybe like cognitive dysfunction, dysphagia, and speech impairments. It is also important to understand that a multidisciplinary team approach is better than only offering physical therapy or exercises. This is a major misconception in developing countries like Pakistan, in which patients would undergo months and months of physiotherapy and physical therapy exercises, but they do not improve. Why? Because a patient with Parkinson disease does not only require physical therapy, he or she also requires a multidisciplinary team with all rehabilitation professionals that I just mentioned. It is important to understand this point and also educate the patient and the caregiver at the start that rehabilitation is going to improve the mobility, quality of life, and reduce the fatigue. But it's not going to reverse the disease process itself. And that's why it is absolutely important to be in touch with the trained neurologist all the time during the treatment protocol of Parkinson disease. There are many rehabilitation interventions being offered in Parkinson disease, and you can divide them into conventional and the recent advances. The conventional includes initial disability assessment, evaluation, and goal setting. So in rehabilitation, this is done by using the international classification or the ICF model of World Health Organization. This ICF model takes into consideration the age, intrinsic and extrinsic factors that would actually determine the overall disability of the patient. For example, from medical point of view, a patient maybe he comes from Lahore, Karachi, or maybe interior Sindh, or a far off area from Punjab, or maybe from Gilgit-Baltistan. The medical management or the medication would be the same for every patient, but the disability is going to be different in different patients depending on their age, their background, the social support system they have, and the pre-existing disability with which they come to the doctor. Apart from that, physical therapy is basically physiotherapy, which is a very important part of the whole paradigm of Parkinson's disease rehab management. So physical therapists basically focus on gait training, stretching and strengthening exercises, and certain things that improve the mobility of the patient. Occupational therapy is actually not available all across Pakistan. So that's why people have misconception that what is the role of an occupational therapist. In simple words, an occupational therapist works on improving the activities of daily living performance in a patient with Parkinson's disease or any other neurological condition, number one. Number two, occupational therapists are expert of upper limb, and they can also help the patient with home modification, environmental modification, and also with the prescription of wheelchair. A speech therapist is not only going to assess the patient for communication deficit, dysarthria, dysphagia, and other things, he or she is also going to advise patient regarding all the exercises and communication devices that can be used in a case with Parkinson's disease. Cognitive rehabilitation is important because many patients with Parkinson's disease, as the disease progresses, are unable to perform simple tasks. They are unable to communicate. They are unable to focus on a particular task that is maybe the requirement of their office or maybe of their the place where they work. Cognitive rehabilitation by using certain cognitive and mental exercises helps the patient regain that cognitive loss dysfunction, which will allow him or her to move back to the society and perform the simple tasks that you and me take for granted. There have been certain advances in rehabilitation of Parkinson's disease. Now, I'm not going to say that these are very recent advances. Some of these advances are available to people in the West for the last 10 years. But unfortunately, they are not available freely to people in Pakistan. Many of these advances are not technology dependent. They are not very costly, and they can easily be integrated in your own practice. So just for food for thought, I'm going to share a couple of them. the gait training is a major issue in Parkinson's disease because this is one of the most important symptoms for which the patient is going to seek opinion of a rehabilitation professional. There is something called Nordic walking or pole striding. Pretty simple thing. What happens that जब आप कभी नोट करें जब बर्फ में जाते हैं तो you use two poles to walk in the snow. So using these two simple poles in a rhythmic oscillatory movement, people can improve their gait pattern, and this has to shown to be very much effective in case of early to moderate degree Parkinson disease. So this randomized control trial, few of the highlights of the study are that the traditional treatment and the traditional gait training protocols do not fully address the gait difficulty in a case with Parkinson's disease. So pole striding improved gait rhythmicity and step and stride amplitude. And it was recommended that regular pole striding may reduce the risk of falls in Parkinson's disease. Another randomized control trial was conducted, which showed that Nordic walking or the pole striding only for 60 minutes, 12 sessions from 6 to 24 weeks will result in improved gait balance, quality of life, functional capacity, and motor function in cases with Parkinson's disease. Tai Chi is a traditional Chinese exercise, very popular all around the globe. Tai Chi can be performed by people suffering from any neurological disorder that impairs balance. It can be performed by any age group, maybe a young person or maybe an older person in their 90s. It can be performed in a group setting. It can be performed individually. It can be performed while the person is standing. It can be performed while the person is sitting in a chair. And again, it does not cost any money. It is safe and it is being done all around the globe. And again, a systematic review and meta-analysis and other research that was done on this topic showed that Tai Chi has a role to play in improving balancing, coordination, and mobility in cases with Parkinson's disease. You must be familiar with the stationary bicycle or the exercise bicycle, which is commonly available and many people have it at home as well. But the problem with a stationary bicycle or a static bicycle is that the person with Parkinson's disease has a poor balance, and many of them are unable to use the standard stationary exercise bicycle. So in such cases, there is a role for recumbent cycle training. This is safe, available in Pakistan, and it can be easily used for patients in Parkinson's disease to improve their balance, coordination, and mobility. So again, a randomized control trial concluded that in cases who underwent this recumbent cycling over a period of 3 months, there was significant improvement in almost all functional outcome parameters. So something that is available in Pakistan and can be utilized. Exergaming is basically very simple. It is the use of commercial games like Nintendo Wii and Xbox Kinect, in which the person stands in front of the screen and the avatar moves in response to whatever is being done by the person. So this is very commonly being used in the West and also now in Pakistan in certain centers for different kind of neurological and orthopedic disorders. Again, a lot of research has been done. I'm not going to share all of them, but the summary is that exergaming is an emerging tool to help rehabilitate motor skills in people with Parkinson's disease. Why? Because it provides an enriched and stimulating environment. The major issue with other kind of rehab is कि मरीज रोज एक ही तरह की एक्सरसाइज कर करके तंग आ जाते हैं, थक जाते हैं. If you provide them with exergaming, it gives them a different sort of flavor. Interesting भी होता है, different भी होता है और बड़ा engaging भी होता है. So people are more likely to engage in exergaming than a simple exercise for a long period of time. ये safe है, it's feasible, it is available all around Pakistan and developing countries. Second hand आजकल 30,000 का आ जाता है. और आजकल अगर आप वैसे कोई घर पे फिजियो को मंगवाएं तो एक महीने में आपके 15 से 20,000 वैसे लग जाते हैं. And the research has shown that balance-based exergaming training resulted in greater improvement in postural stability as compared with conventional balance training. Other emerging option will not go in detail, variable technologies and sensors. So these variable technologies are worn by the patient. They provide real-time data to the doctor, and they also help in collecting data which can then be used to tailor the treatment and rehab protocol of the patient. Non-invasive brain stimulation, my colleague has described that in detail. I'll skip that. Lee Silverman voice treatment, LSVT. This came in 1980s and there was a lady known as Mrs. Lee Silverman. उनके लिए ये treatment बनी थी और अभी पूरी दुनिया में use होती है for Parkinson disease. Over the last 30 years, there have been many variation. इसमें क्या नाम है LSVT loud है, which is basically for rehabilitation of voice and speech dysarthria in case of Parkinson disease. Then there is LSVT big, which basically focus on motor dysfunction and exercise and mobility. And recently LSVT app was launched, which allows the patient to do all these things at home, and it can be monitored by the therapist or the rehab physician in their office. Telerehabilitation is also an emerging tool, and a couple of articles which had been published, especially after COVID-19, have showed that there's a lot of room to explore in case of telerehabilitation in rehabilitation for Parkinson disease. There are certain challenges that we face usually when offering neurorehabilitation to patients with Parkinson disease. The first and the foremost is lack of awareness about the role of rehabilitation. The eye cannot see what the mind doesn't know. Unfortunately, public को भी नहीं पता होता और बहुत सारे डॉक्टर्स को भी इस बात का अंदाजा नहीं है कि पार्किंसन डिजीज में medication is only one part of the solution. You have to integrate appropriate early multidisciplinary rehabilitation in order to get good results. So जब पता ही नहीं होगा तो रेफर कब करेंगे, रेफर नहीं करेंगे तो बहुत सारे मोटर और नॉन मोटर सिम्टम का प्रॉपर अप्रोप्रिएट इलाज हो नहीं पाएगा. Then unfortunately limited access to rehabilitation services. And please understand, this is not a challenge for only for Pakistan. This is also true even for country like USA, जहां हमसे बहुत बेहतर medical healthcare setup है. So rehabilitation therapy utilization among older patients with Parkinson's disease is low even in the USA. और पाकिस्तान का दूसरा चैलेंज ये है कि हमारे जितने भी अच्छे rehabilitation centers हैं, ये सारे के सारे अर्बन एरियाज में हैं, मेजर सिटीज में हैं, और रूरल सिटीज में अनफॉर्चुनेटली ऐसी कोई एक्सेस नहीं है. The next challenge is lack of multidisciplinary collaboration. So for most of the people, rehabilitation means only physiotherapy and exercises. It's important, it's a very essential component, but then it is not the only component. Multidisciplinary means उसमें rehabilitation medicine physician भी होगा, उसमें occupational therapist की input भी होगी, speech therapist भी होगी, और साथ clinical psychologist for cognitive rehabilitation भी होना चाहिए. And then adherence to rehabilitation program is very challenging, particularly in case of Parkinson disease, because of the element of fatigue, number one, because of lack of motivation on the part of the patient, because of sometimes lack of social care, and obviously it is a very costly treatment. Rehabilitation costs a lot of money because it has to continue sometimes for a couple of months, and it costs a lot of money. Sometimes, unfortunately, people are unable to adhere to rehabilitation protocol in the long term. So the summary is that neurorehabilitation intervention have shown to improve motor function, to reduce the fall, improve quality of life, and delay the progression of Parkinson's disease based on the data in the last 40 years. But we feel and we face several challenges while offering rehabilitation treatment and rehabilitation intervention to our patients. And therefore, early rehabilitation can make a positive difference, and a multidisciplinary team approach is always preferred. I would request that all of you, at least who are listening to this webinar in the middle of the night, please be an advocate for comprehensive Parkinson's disease management. And a comprehensive treatment includes early rehabilitation referral. Or ideally, the referral should be to rehabilitation medicine instead of only physical therapy. Educate your patient and support them for rehabilitation, guide them and tell them what is right, what is not. And you have to think beyond exercises and physiotherapy, and you have to integrate a multidisciplinary team approach. Please collaborate with other rehabilitation professionals in order to provide an appropriate service to patients who are still bedbound, who are still confined to their homes despite good medical treatment. So thank you very much. If you need a copy of the presentation, feel free to email me at this address. Thank you, Ji.
Thank you very much, Dr.